Listen, having irregular periods, stubborn weight, facial hair, fertility struggles, and persistent acne sounds like PCOS, and that is not for the weak. And on top of that, having a doctor trying to throw birth control and metformin in your face without even explaining the condition is low-key disrespectful. Now, that's actually very much high-key disrespectful. Those symptoms are not random, y'all, though. They are actually cues from the body telling you, I need some help up in here. And your body dang sure isn't looking for another pill. Nah, not that kind of help. So let me tell you everything you need to know about PCOS. 1 in 7 women of childbearing age are suffering from PCOS right this minute. What? Yes, PCOS affects so many women around the world, and it's most common in women of African, Hispanic, and South Asian backgrounds. When you have PCOS, there are 3 main things that happen. Your periods become irregular, your body makes more male hormones than usual, and small cysts start to form on your ovaries. All of this while the mainstream treatments leave you feeling trapped in a cycle of medications and side effects, never truly addressing what's causing your PCOS in the first place. But from this day forward, we are going to do things differently and we are going to do it naturally. But first, let me explain to you what actually causes PCOS in the first place. So just like how you might inherit your eye color from your parents, you can also inherit a tendency to develop PCOS. Think of it like having a recipe book. Some people have extra ingredients, like genes, that makes them more likely to develop the PCOS recipe. In PCOS, several genes are going to affect how your ovaries work, including the CYP gene that controls how your ovaries are actually making the male hormones, insulin receptor genes that actually affect how your body processes insulin and regulates your blood sugar, a change in the PAI1 gene, which is linked to higher risk of miscarriage and heart problems. You probably wouldn't even know that you have all those genes because your regular doctor isn't checking for all that. But these genetic differences explain why your ovaries might make too much male hormones, or your body may have, trouble with creating insulin or using insulin. And some women have higher levels of complications like miscarriages and infertility because these gene differences are going to trigger a cascade of other issues. When you have PCOS, your body's hormone levels are going to get out of balance. First, the male hormones, androgens, are going to increase, which affects your monthly cycle. And then your female hormones, estrogen and progesterone, are going to become unbalanced. At the same time, your body is going to start having, trouble processing sugar properly, a condition called insulin resistance. And when your body can't use the sugar effectively, it's going to produce more insulin to compensate. This extra insulin is going to actually cause your ovaries to work overtime, leading to several problems. More male hormones being produced, small cysts forming on the ovaries, problems with your egg releasing during your cycle, damage to your ovary tissue, and inflammation in the ovaries. This chain reaction doesn't just affect your ovaries though, it impacts your whole entire body. When this happens, you're going to notice that you have weight that's hard to lose, inflammation in your body, higher levels of inflammatory substances in your blood, and risk of other health issues over time. But just because you have these genes does not mean that you have to suffer from it. So you can't change the genes that you were born with, but you can control how they're expressed through your daily choices with what you eat, with what you do, and the nutritional info that you pass to your body. Let's talk about that. So you've probably heard the saying, your genes load the gun, but your lifestyle pulls the trigger. That is absolutely true. You can have genetic predispositions for like 20 or 30 different health issues or diseases, but your lifestyle choices are largely what are going to determine whether or not they manifest. And whether you have PCOS related genes or not, you're going to want to focus on 3 specific things: what you eat, how you move your body, and how you rest. These are going to be the key factors to help you lower your risk of PCOS and really any condition for that matter, whether genetic or not. And here's how you can do that. Number 1, eat right. Everything you put into your body is going to either promote health or lead to disease. Food is information for your cells. Every single food and every beverage item that you consume will get transcribed into your DNA, tissues, and your organs. And when you have PCOS, the goal is to keep your hormones balanced, prevent unwanted tissue growth, and keep your ovaries working properly. You can reach these goals by avoiding foods that stress out your body. What foods actually stress out my body? I'm glad you asked. Processed foods high in sugar and simple carbs make your blood sugar spike. Coffee can affect your fertility and reproductive health. Fried foods and unhealthy fats may increase your heart problems and worsen PCOS symptoms. And another lifestyle thing you're going to want to focus on is to move more. Exercise should be intentional, at least 30 minutes every single day of purposeful movement. This does not mean casually walking at work, mowing the lawn once a week, or occasionally gardening. You need to be for real. Be for real. Get your heart rate up and your blood pumping. A 30-minute walk every single day should suffice. And if you can talk while you walk, start running. Another really important thing you're going to need to focus on is to stress less. Our endocrine pathways and HPA axes are interconnected, which means stress directly affects our hormone system. And while exercise can help with stress, it's important to actually manage your stress through meditation, intentional stretching, and breathing exercises. These practices are going to help to reduce your stress, anxiety, and depression, all while lowering your cortisol levels and improving your overall life satisfaction and quality of life. All factors that can affect how PCOS shows up in our bodies. And after, not before, you focus on those specific lifestyle changes, then you're going to want to start diving into a little more natural support. And that's going to include herbs. When using herbs for PCOS, focus on herbs that help your body handle stress better, balance your hormones, improve cholesterol levels, control blood sugar, support liver function, and help reduce cysts. And here are some specific herbs that can help that. Black cohosh to help balance your hormones by improving your period, supporting healthy pregnancy, and reducing inflammation. Cinnamon to help control blood sugar levels and make your insulin work better in your body. Licorice root to help reduce male hormone levels and help with stress and decrease unwanted hair growth. Chaste tree berry to help regulate your periods and balance your hormones. Fenugreek seeds to help shrink your ovarian cysts and to make periods more regular. And peony, which helps to increase your progesterone, a female hormone, and decrease your testosterone, a male hormone, while balancing your other important hormones like estrogen. I get this question a lot. How will I know it's working if I start doing these things? Well, when you start following this more intentional and natural way of healing, you'll begin to notice some positive changes in your body and actually how you feel. And if you do it right, you should see your menstrual cycles becoming more regular and predictable, your energy levels increasing throughout the day, your hormones becoming balanced, leading to clearer skin and reducing unwanted hair growth, your mood stabilizing and you being happier, your weight becoming more manageable. And if you're trying to conceive, you may notice improved fertility signs. But remember, always, healing PCOS is a marathon, not a sprint. It definitely takes time. It takes time for your body to actually respond to these natural approaches. But just be consistent and patient and you will see the changes. If you found this information helpful, don't forget to like this video and subscribe to my channel for more natural health content. Drop a comment below if you have any questions or you want to share your own personal PCOS journey. Your body is a healing machine. You just need to learn how to set up your internal environment for peace, not war. Give thanks.